Okay, so my project is the impact of Menthol nasal inhalants on aerobic exercise and effort between male and female athletes. This is a project that I have started working on at the start of the year, and it is done under the supervision of Dr. Derek Keevy. The key concepts in this are two. There's athletic performance and nasal inhalants. So athletic performance is the overall ability for individuals to complete a task efficiently and effectively. And it is done under various different aspects and a combination of those aspects in order to achieve success doing something. So that is very broad, but it is just overall how efficiently and effectively a person can do a task within a sport or activity. Nasal inhalants are just an administration method that a person can use to deliver drugs or substances through the nose into the nasal cavity that stimulates different sensors or receptors within that region and carries into the lungs and then is breathed out. The two constructs within this are the maximal oxygen consumption, known very well as defined as the VO2 max. It is the maximal oxygen consumption that a person is able to use effectively to generate energy in prolonged exercise. So it's how long a person is able to keep using oxygen efficiently in order to proficiently perform prolonged exercise. The second construct is perceived exertion. So it's a psychophysical tool that assesses a person's output during exercise. So you can use it for a variety of reasons. You can use it for lower body, upper body, and a general use. So within this, I'll be using the original Borg scale of RPE, which stands for rating of perceived exertion. And it corresponds with a person's heart rate, going from 6, which should be no exertion, and excuse this, but it ends at 20, which represents a maximal exertion. This corresponds with heart rate because a person's maximal heart rate during exercise is typically 220 minus their age, which within the population, everybody will be at a max around 200. So within this study, the gap in the knowledge in which I have a reason for conducting it is that Menthol is already commonly used in athletics for a variety of purposes, such as skeletal muscular analgesic properties, joint range of motion, thermoregulation from perception, but through all of those different reasons, no studies have really conducted any sex difference comparisons within any administration method of Menthol. So I aim to look at this difference, and within the nasal inhalation method of administration, it is very limited. I think there's only one study that's done, and it's comparing the US and Canada's different types of this Menthol nasal inhalation method. It is comparing more one of the ingredients that is not in Canada's, that is not legal in Canada. You can only get it in the States. However, most of these methods talk about the effect on a nasal decongestion within sickness, and as well as reducing the coughing sensation within smokers. So already research talks about different ways of applying, such as sprays, creams, and tapes, where within external application, where internal applications include beverages, mouth rinses, and nasal inhalation. There is very contradictory results and conclusions of administration effectiveness. There is some sources say that external is better, where other sources say internal is better. And this could help reduce that knowledge gap in which is better. So within menthanol, it affects the central governor model. This is developed by Tim Noakes and attempts to explain fatigue during exercise through the subconscious. So how this works is that the subconscious brain actually limits the physical performance of a person, and it makes them, the subconscious brain affects the perceived exertion, which goes to the conscious brain and recruits the different motor units to which determines their pace. So if a person has a higher perceived exertion, their brain is going to tell them that we need more muscles to perform this because it's hard, and it will recruit more muscles, which takes more energy, which will result in a lower VO2 max score, as you're not using those muscles as efficiently as possible. So by determining the effect that menthol has on RPE, the potential inference can be made that when a lower perceived exertion occurs, that there'll be less motor unit recruitment, which will cause a more efficient way of running, of aerobic performance, and allow a person to continue further than they normally would. The second model is the psychobiological model, which is developed by Samuel Margora, and it relates to the conscious effect of RPE. So this model relates to the conscious part of the brain as endurance performance is occurring, or aerobic activity is being involved, and it involves factors such as the motivation, the perception of effort, and decision making. So what it talks about is how different psychological factors would influence the pace and if the person wants to continue or not. So menthol's role in this is, if the RPE is lower, then it will also increase a person's time to exhaustion in an aerobic capacity test, because they find it easier to do and they will want to continue more, rather than when it's harder, they want to drop out earlier. The purpose of this is to see if there's an effect of the menthol nasal inhalant on aerobic performance through the perception of thermal, ventilatory, and exertion rates. So thermal is seeing if they feel hotter with or without menthol inhalants. Ventilatory is if they feel like they can breathe easier, or if it's harder to breathe with the nasal inhalant. And the perceived exertion is their overall and their leg capacity during their leg rating of effort during the exercise. The use of the menthol, my hypothesis is that the use of the menthol nasal inhalant will allow for a greater VO2 max score because of the lower perceived exertion, which relates to a better aerobic performance overall. And these factors also apply to this, where the better aerobic performance will be caused by decreased perceived thermal exertion, an increase in the perceived ventilatory action, and a decrease in the perceived exertion rates, which means that they will feel I don't know. Okay, I'm just gonna move on and change that later. So, sampling. There's two different methods being used here, permissive and stratified random sampling. Permissive includes selecting participants based on criteria. So this will be based on my inclusion criteria, which will basically be trained athletes of experienced aerobic fitness. So for example, like these people exercise so many hours a week or for so long, and I will be recruiting them over someone who maybe this is a little lighter gray instead of black, where they still exercise, but they exercise less, and the white are probably sedentary because they won't exercise at all. So I'm trying to grab this population for my sample. Within stratified random sampling, it's a similar but different way of gaining your sample. You'll identify your population. Within mine, it's experienced aerobic athletes, which I will take different groups based on different criteria. So for example, I could use males that train for so many hours a week and males that train at different amount of hours a week, with that still maintain my criteria of being aerobically, that aim to aerobically train their aerobic fitness at least for the past 3 years and currently do so as well, where the groups 3 and 4 will also be the same way, as they could be divided into experience, but also gender. My inclusion criteria is that they're 18 or older, their BMI is in a normal range, and they currently and previously participate in aerobic fitness training. And the last is they're willing to participate in the research study. My exclusion criteria are that they're not allergic to any of the intervention substance or the placebo, which includes menthol and essential oils. They don't have any compromising orthopedic problems. They are not a current or past smoker. They don't have drug or alcohol abuse symptom history. They don't have any diseases relating to a contradiction for maximal exertion. So we want to make sure that they're safe to participate in this study, or if there's any limiting cardiovascular or neurological disease that would limit their performance or increase their chance of any harmful drawbacks from participating in the study. We don't want any of those. And if they're pregnant or if they're currently breastfeeding. So within my protocol, maximal incremental test, an MIT, will be used on a treadmill, and it will consist of 4 lab visits, 3 of which will be testing sessions. The familiarization session will include taking their baseline measures such as body weight, height, and body fat percentage, as well as BMI. Additionally, they will be told exactly what they're doing in the study and their warm-up, the testing procedure, and their cool down, and everything that's included in the testing session. And within the 3 testing sessions, the 3 different inhalant methods, everybody will start with the control, which is just water. It's not any intervention. Then they'll do, these 2 are randomly counterbalancely controlled. So there will be the same amount of participants that perform their second testing session with the placebo as they do with the treatment. For example, 20 people will do each. So 20 people for the placebo first, 20 people for the treatment first. There will be a washout period of 1 week, as this is determined by the amount of time that it takes for fatigue to reduce, to ensure that fatigue isn't a factor within this, as well as there's no residual from the menthol supplement session. After the procedure is done, the participant will remain seated for 5 minutes, and their blood pressure will be taken to ensure that they're safe to leave the lab and they performed it well. So within the testing procedure, they'll do a warm-up of 3 minutes at 8 kilometers an hour. And after that, they will start at 9 kilometers an hour and increase 0.3 kilometers an hour every 25 seconds at a fixed rate of 1% of inclination. This incline doesn't change as many do because it's hard to remain consistent, and this is a very big problem within VO2 max testing, as it is very inconsistent and there's a variety of the amount of speeds and inclination that is set for both. It is wild how different all of the procedures are. But for the participants to have a valid VO2 max, they actually have to meet 2 of this criteria. So most of the time, or all of the time, they'll reach the volatile exhaustion, but they also have to meet another one, and if they meet any of these others before they're like volunteering that they're done, that they do reach a valid VO2 max. These 4 criteria are the leveling off of the VO2 max value or VO2 value on the metabolic cart. Their RPE exceeds 17 on the Borg scale. They reach volatile exhaustion, or the achievement of the maximal heart rate of the participant is reached. The independent variables in the study are 2, one that has 3 levels and the second has 2 levels. Within the treatment group, it consists of the control, placebo, and intervention methods, and the gender is in 2 levels as male and female, and all of these people, so a male will do all 3 trials independently, and the female will do all 3 trials independently as well. So it is a 2x3 mixed factorial, 2x3 mixed factorial design, where the between subjects aspect is that it's between male and female participants, so we'll be comparing those aspects, as well as a repeated measures aspect to see the difference between the inhalation methods between the different genders. So males will be compared to males and females will be compared to males. Females will be compared to females. So taking that into consideration, each participant completes each trial and all of that data will be tested. As said before, the order is determined by a randomized counterbalance design. So each participant will do the familiarization test first. It's not a test, they're not doing any activity in it, they're just being assessed and data collections for their baseline measures, not their baseline, their information such as height, weight, BMI, all of that. And the control will be done second, and then there will be the same amount of participants between the placebo and the intervention method of menthol. And the dependent variables are the VO2 max through the MIT test, which is the body's ability to utilize and use oxygen by generating energy during aerobic muscular activity. Time to exhaustion is a time, so it is how long they take to reach that fatigue level and how long it takes them. Yeah. just how long it takes them to reach their maximal fatigue. And then the RPE, which is the same psychophysical tool for effort during exercise. The RPE can also be increased because of muscle fatigue, their breathing, and their heart rate. So those are kind of some indicators of how it's affected. So within the data analysis, I'll first start by completing a Shapiro-Wilk test to see if the data is normally distributed. And then I will continue doing inferential statistics within a two-way repeated measures ANOVA, which I will see the effect of the different inhalation methods, the control, placebo, and menthol, and the effect of gender between male and female, and also the interaction effect between the inhalation condition and the gender. So for example, the male control and the female control. The male placebo, female placebo, and then menthol male, menthol female. If there is significance found in this two-way repeated measures ANOVA, a post-HOC test will be done to see where the significance is found between groups. And that is it.